HIPAA, or the Health Insurance Portability and Accountability Act, was first enacted in 1996. Originally, HIPAA's focus was to protect patient data when patients transferred between different healthcare providers or different health insurance companies. However, the scope of HIPAA has grown over time. Now it includes digital health technologies that store and process patient data along with conventional health insurance and medical providers. This means that whenever you're building a digital health software, HIPAA has to be taken into account from the ground up in the development of your software. So what's a covered entity under HIPAA? Originally, it was a small list of healthcare providers and health insurance plans. However, now a covered entity is any organization that stores, utilizes, or transfers PHI, or protected health information. What's protected health information? Well, there's a long list of PHI that could mean that you are a covered entity under HIPAA. But generally, PHI refers to things like patient names, dates, treatment information, telephone numbers, social security numbers, medical record numbers, account information from health insurance accounts, all the way through to things like biometric data. In short, if you're a digital health company, the chances are that you are storing or utilizing PHI, which means that you need to have in place on the back end all of the relevant processes, and you need to build your software with HIPAA compliance in mind. So HIPAA is triggered when companies have PHI and when those bits of health data are transferred electronically and is subject to the privacy rule of HIPAA, which we'll get into later. In short, what this means for developers is if you are building a piece of software using patient data that is not anonymized in any way, where you have the PHI readily available and visible, you have to have security in place around how you transfer that data. You have to have security in place around how you store that data. And you have to have processes in place around what happens if there's a data breach. The HIPAA breach notification rule outlines timelines and required information around breaches, such as reporting, who needs to be reported to, and the level of the impact. But generally, victims and relevant authorities must be contacted within 60 days of information about the breach. This means you need to build in place a process whereby you can notify anyone whose PHI has been exposed in a data breach. The most common HIPAA violations are things like hacking and phishing, loss of devices, poor disposal of PHI, human error. Generally, good development takes into account these types of violations because when you're building a software, you're building it to protect against things like hacking and phishing. Good development also means that you have a process in place to dispose of PHI. However, if you're developing a software, you may want to limit the number of people who have access to the personal health information. Because if you limit the number of people who can access that data, you're limiting the number of vectors for possible violation or possible breach. HIPAA outlines a series of safeguards: physical, technical, administrative. For example, computer software, firewalls, multi-factor authentication, etc., to protect the data and protect the access to the data. You need to make sure you have the best safeguards in place and that you've documented the safeguards you have in place to protect yourself. HIPAA risk assessments must be carried out to identify vulnerabilities. Again, these risk assessments should be documented to show that you've been doing them over time and to help you to implement better protective measures for the PHI that your business is utilizing. If the worst happens, there are substantial penalties and fines. These penalties and fines, of course, take into account things like malicious intent, the quantity of exposure, potential for future risk, etc. However, the risk to digital health companies goes far beyond the fine. It is a risk because it will hurt the reputation of a digital health company if they're seen to be in violation of HIPAA. It's a risk because it could affect future investment. It's a risk because it could make people not want to work with your organization. If you're a digital health software company, you need to build your solution from the ground up with HIPAA compliance in mind. You need to build internal processes to document that compliance as well. At Virtual, we're digital health development experts. We work with ambitious digital health companies from across the globe to help them to develop their software better, faster, and in a more compliant way. Contact us today to learn how we can help you build your digital health solution.